Facial rejuvenation mistakes. Things you really shouldn't do in your goal to look young. Hi, I'm Dr. Athre with ATHRÉ Facial Plastics. I'm a double board certified facial plastic surgeon here in Houston, Texas. I'm also the inventor of the 4D facelift. One of the biggest chunks of my practice is facial rejuvenation. I have seen it all. I've seen patients that have excellent skin texture, volume for their age, and I've seen the other end of the spectrum as well. So the search to look young and look as fresh and rejuvenated as possible is nothing new. This has existed for all time. However, the one thing that we have that patients in prior generations didn't have is the amount of different stuff that is being thrown at potential patients on a day-to-day basis. Whether it is advertising on TV, Instagram, Facebook, TikTok, every social media platform out there has stuff being thrown at you on a daily basis. Some of the things work, some of the things don't. This video is going to kind of highlight some of the things that you shouldn't do. Because everyone has a million different options, I think it's really important for us to kind of at least give a framework of how to navigate this space properly to get the best potential results long term. So that being said, let's jump right into here and talk about the things that you shouldn't do. Number one, overdoing fillers. This is a big topic. We could probably talk for years and years and years just on this. I think it's really important to understand, how did we get here? So fillers is a relatively new concept. So probably till all the way through the 1980s, the only real filler there was collagen. And collagen would have a lifespan of about a month or so, maybe even a few weeks. So patients would actually come into the doctor about a couple weeks before a huge event, get a little bit of collagen injected into their face, go home, and that was about it. For everything else, there was surgery. Now, as we fast forward that timeline down into the 1990s, late 1990s, early 2000s, we started to get this group of fillers called hyaluronic acids. Hyaluronic acids are basically made in the laboratory, and they're made of the same chemical that you have in your knee or in your elbow. So that stuff that lubricates your elbow is made in a laboratory, put into a syringe, and we can inject that into the face. Chemical modifications of that chemical allow you to make that thing last anywhere from 6 months all the way to about 10 months to a year. So there's different little, I'd say, subcategories of hyaluronic acids. Some common ones that you've heard are probably Restylane, Juvederm Ultra Plus. All of these things that we just throw out there, they're all hyaluronic acids. So let's put that on stop for a second and go, why are we using these things? So one of the things that happens as we age is that we lose volume, okay? This has been noticed over multiple decades and multiple studies, and we lose this volume in different places. So number one, so we lose volume in actually the thickness of the skin. So the skin is made up of different layers, and it's got this thick collagen elastin matrix. Think of it like a sponge. So if you have a nice fresh sponge that you just open out of the package, it's nice and plump and it can hold a lot of water. It has a lot of form. As the sponge gets old and kind of ratty, that sponge is not able to hold as much water and is kind of limp. This is what happens as we lose collagen and elastin in our skin. We lose the volume, we lose the ability to maintain moisture and volume in that structure, and you get limp skin. We also lose volume in the bone volume, so our skull actually starts contracting a little bit. So all of this shows that we lose volume over our entire face, and you see the result in tissues falling, in tissues getting laxity along the jawline. All of these are symptoms of that. So someone went, ta-da! If the problem is loss of volume, why don't we put volume in? And this is where the filler craze went crazy. So I do agree that fillers probably have a role in mild facial aging where they can add a little bit of volume and it looks pretty good. However, once the tissues have really started to fall, putting a lot of filler in there really doesn't start looking good. The filler itself does not have enough strength for pushing power to really hold the tissues up. So what really happens to these patients is they just look poofy rather than actually rejuvenate it. So when you see some of these famous movie stars and all these things, and you see them on these photos and you can see they just look poofy, this is what's really happened. So one of the things that I will tell you in terms of avoiding that look, I have really changed my own philosophy, and I've really kind of put fillers off to the side. I really like revolumizing the body with your own fat. And I do this very, very frequently in conjunction with a lifting procedure. So the actual tissues that are fallen are lifted back to where they're supposed to be with the lifting procedure. And you're adding the volume selectively to areas that have lost volume using fat. I find this works better, looks more natural, less complications. So all that put together, big thing to kind of perk your ears and stay away from overfilling the face with filler. And this actually is kind of hard because there's a lot of pressure put on patients with med spas and all sorts of providers that throw stuff at you going, hey, come on in, we can make you look a lot younger with a couple of syringes. When something sounds too good to be true, it probably is. So next major category, ignoring skin elasticity. So as I just talked about, as we age and we lose that collagen elastin matrix, our skin's bounce tends to go down. So there are things that can be done to really enhance that skin bounce. Now, I'm going to kind of give you a little caveat on this coming from the standpoint of a facelift surgeon. One of the things that I've looked at my own patients and seen the patients that have the best facelift results are patients where I have really addressed their skin elasticity along with the lift. Patients who have really poor quality skin, you can lift them till the cows come home, but the result doesn't look as good as someone who has good elasticity within their skin. So this is another plug to protect your skin as much as possible with sunscreen and all of the other things that you do to keep healthy skin. But on the side note, one of the things that can be done to improve the actual oomph to the skin are as follows. Stage one, things like microneedling. Microneedling works really well by creating some small micro injuries in the skin that enhances the skin's ability to build collagen and elastin. Chemical peels. I think chemical peels is kind of moving up the little step ladder to the next level, but works fantastic and does the same thing. So I like to use TCA peels, and they come in different concentrations. Some of the very mild concentrations I think are very appropriate to be used at the med spa level, but in my hands I like using stronger concentrations, and this really does help with increasing the elasticity, collagen production, and elastin production of the skin to give back that bounce. Moving to the next step on the ladder, laser. So the CO2 laser is the gold standard for building collagen and elastin in aging skin. How does it work? So basically what you're doing is you're creating, again, injury into the skin using the laser at a deeper level to create that collagen and elastin. Now the laser can be subdivided into multiple levels. I think there's a common term that most people have heard, which is Fraxel. Fraxel is fractionated laser, where you're actually making micro injuries with the laser to enhance the collagen production. Now the advantage of Fraxel is that since you're leaving fresh skin in between those little micro injuries, the downtime for a fractionated laser is less than if you're doing a full ablative laser. Now, whenever I say these things, I'm sure I'm going to get comments, oh, so Fraxel's better, right? No, Fraxel has its role, full ablation has its role. Everything has its role in the rejuvenation process, and we've got to use the right tool in the right patient. All right, so those are some things that can be done. Step ladder, recap, microneedling. Step ladder 2, chemical peel. Step ladder 3, lasers. All three of these enhance the oomph to the skin by increasing collagen and elastin production. Another big mistake that people do is not taking into account the texture of the skin. So skin, as you're losing some of that collagen and elastin, the superficial skin, you'll see some of these fine lines in there. Another thing that can happen is you can also see large pores, especially in the T-zone. These textural issues with the skin can be corrected. Some of the things are topical agents like retinol and retinoids. They help by actually, again, causing some of the collagen rebuilding and skin turnover to get smoother skin. The other thing that can be done for the superficial texture, chemical peels work really great, especially some of the milder peels, and as well as a very mild laser peel can also work at helping with the textural issues of the skin. Moving along, things you shouldn't do. Here's probably one of the biggest things, neglecting sun protection. So many times in this video, I have put together this idea of healthy skin and unhealthy skin or aging skin. The number one thing, actually probably number one and number two, is sun protection. You have to use sun protection. I remember, I think it's from medical school, when we read an article that the your primary risk of melanoma in your life is really dependent on the number of bad sunburns you receive before the age of 12. Age of 12, which means this really highlights how important it is to have a good quality sunscreen, teach good sun hygiene habits for your entire life. This really re-emphasizes that very important point. So one of the things to do, number one, don't go for a walk when it's 2 o'clock outside. Wear a hat. Okay? Protect your skin and your face physically from the intensity of the sun. After all of those things, make sure you use a high quality sunscreen on a daily basis. If you're going to be outside for an extended period of time, you're probably going to need to have something that's a little bit more tough, like a zinc oxide, titanium oxide based sunscreen as a physical block, and you're probably going to have to reapply if you're perspiring. This is probably one of the biggest components to protecting and preserving your skin long term. All right, other big facial rejuvenation mistakes that you can make. Choosing the wrong procedures. This goes back to our little filler portion that we were talking about earlier. It is clearly evident that things are being thrown at you. There's another video that I made a few days ago about the top things I wouldn't do as a plastic surgeon. One of the things on there are energy-based devices. There's a lot of attention being thrown out today on things like Morpheus, Thermage. These are some common names that have been thrown out. These are energy-based devices that promise skin rejuvenation without an incision. The way they work is basically adding some sort of energy, most of the time it's radio frequency, to heat up the tissues underneath the skin and the muscle layer to try and lift the tissues. You might get a short-term result. Repeat, you might get a short-term result. Long-term, it's just not going to work. When those tissues have fallen, a little bit of energy is not going to lift them up, okay? However, this is a double whammy. Not only do you not get the result that you want, when you actually come and see the surgeon for a potential procedure to rejuvenate, that procedure is now harder because of the scar tissue caused by these energy devices. So when I go and see a facelift patient, I ask them, hey, have you had Morpheus or have you had any of these energy-based devices? In today's world, the vast majority of my patients say, yeah, I tried it out and it just didn't work. So now when I do their actual lift, it takes twice as long. There's going to be a little bit more attention that I have to pay because the planes, the surgical planes where I'm dissecting, are all stuck together. So there's the double whammy. The other big thing that falls in this category are the little barbed threads. Again, it was on my video about the 5 things I wouldn't do to my face. So when these tissues fall, these tissues actually are quite, I'm going to use a word, heavy. Okay, they have a lot of downward pull to it, partially because of the weight of the tissues, but also because of the ligaments and the muscles to the face. There's a lot of attention now been thrown out on social media with this little barbed wire thing where they make a little incision and they pull it up and the barbs hold the skin up. It's not going to work, okay? It just doesn't work. The number of people that I get who are unhappy with that result is horrible. Then it does the same double whammy that the energy devices do, is that there's scar tissue in those areas. So you put all this together, you're better off kind of getting a holistic, managed approach to your rejuvenation. And this is what I'm really going to end with. When you make this kind of a priority and you say, hey, I really want to look good, I want to look rejuvenated, and I want to protect my investment, who I am, what I am. A whole balanced, holistic approach is the most important thing that I can tell you for long-term success. Managing all these little issues, not jumping towards quick fixes and results that are too good to be true. And I know there's a lot of stuff being thrown at you that kind of show these types of things. It is important to take all of this with a grain of salt and really do the research on there. And this is one of the reasons that I put these videos out there, to try and make it a little easier for my patients to take this vast amount of information that I have and kind of simplify and put it into a logical thing to prevent you from making these mistakes. Part of it is I'm selfish in the process because it's a lot easier to dissect when there isn't scar tissue. So yes, there's a self-serving point to the video as well, but I just wanted to throw that out there. So when you see these videos, I hope they've really been educational. You've gotten a lot of information from them, and you really have an idea to the way I think. If you like the content on here, please hit the subscribe button. If you have more comments, questions, things like that, hit me up with a comment in the comment section or message us, and we'll try to get back to you. It's been a lot of fun to put this educational content out, and if you've got suggestions for other things that you would like to see on here, send us a message. I'm Dr. Athre, ATHRÉ Facial Plastics, Houston, Texas. Thank you so much for watching.